Good morning, everyone, and thank you for being here today. I am pleased to welcome you to this presentation. Today, we will be discussing common audit findings related to document review. The presentation is titled Common Audit Findings, with a focus on document review. We will explore the typical issues identified during audits, share insights on how to address them, and discuss best practices for effective document review. I look forward to engaging with you all and sharing valuable information that can help improve your audit processes. Let's get started. Let's talk about the introduction to document review. This is a critical activity within good manufacturing practice, or GMP, because it helps ensure that pharmaceutical records are not only accurate but also complete, traceable, and compliant with regulatory requirements. When regulatory inspections or internal audits take place, deficiencies in how documents are reviewed often come to light. These issues can have a significant impact on product quality and data integrity, which are crucial for patient safety and regulatory compliance. Regulatory agencies expect pharmaceutical companies to have robust review systems in place. These systems are designed to catch errors early, prevent noncompliance, and ensure that documentation practices are reliable and consistent. Now, why is this so important? First, proper document review supports product quality and patient safety, making sure that everything is as it should be. It also ensures data integrity and traceability, so we can track every step of the manufacturing process accurately. Additionally, demonstrating GMP compliance through thorough review processes helps us stand up to inspections and audits. It also enhances our readiness for any inspections, showing we're prepared at all times. And finally, effective document review helps us prevent regulatory actions and product recalls, which can be costly and damaging to the company's reputation. So, as we move through this presentation, keep in mind that strong document review practices are foundational to maintaining quality, compliance, and trust in our products. Let's take a closer look at risk impact. When we talk about product quality risk, we're referring to the potential for issues that could compromise the safety, efficacy, or overall quality of our products. This is critical because it directly affects patient safety and our company's reputation. Regulatory noncompliance is another major concern. Failing to meet regulatory standards can lead to penalties, recalls, or even loss of license. Inspection observations are often indicators of underlying issues and can highlight areas where our processes need strengthening. All of these factors can impact business continuity, potentially causing disruptions that affect our supply chain, market trust, and financial stability. Moving on to the types of document review deficiencies, these are the specific areas where our documentation might fall short. For example, documentation errors can lead to misunderstandings or incorrect data being used in decision-making. Data integrity deficiencies threaten the reliability of our records, which is fundamental for compliance and audit readiness. Incomplete review practices might leave gaps that allow issues to go unnoticed. Missing approvals or signatures can question the validity of documents, while inadequate investigations mean root causes aren't properly addressed. Electronic record control failures can compromise data security and traceability. SOP noncompliance points to deviations from established procedures, risking inconsistency in our processes. Lastly, training deficiencies can result in staff not fully understanding or correctly implementing the required standards and procedures. All these deficiencies tie back to our overall goal, maintaining the highest standards of quality and compliance. Recognizing these risks and deficiencies helps us strengthen our controls and ensure we're prepared for audits and inspections, ultimately supporting our commitment to excellence across the organization. Let's take a closer look at some common documentation practice deficiencies related to GDP. These are issues that often come up during audits or reviews. For example, we frequently see incomplete entries in records, where critical information might be missing or not fully filled out. Missing dates or signatures are also common, which can seriously undermine the traceability of the documentation. Overwriting without justification is another problem. It can cast doubt on the authenticity of the record. Using correction, fluid, or leaving blank spaces in documents are practices that compromise data integrity. Illegible handwriting makes it difficult to interpret the records accurately, and backdated entries can misrepresent the actual timeline of activities. These deficiencies are more than just paperwork errors. They pose regulatory concerns because poor documentation undermines traceability, reliability, and data integrity. This is why adhering to good documentation practices, or GDP, along with ALCOA plus principles, is essential. They help ensure our records are complete, accurate, and trustworthy. Ultimately, maintaining high standards in documentation supports the overall quality and compliance of our operations. Now, let's take a closer look at some common data integrity observations that can come up during audits or reviews. First, it's important to understand the regulatory impact of these issues. High-risk findings, such as significant data gaps or manipulation, can lead to serious consequences like warning letters or import alerts, which can really affect the company's compliance status. Next, we'll revisit the ALCOA plus principles, which serve as a foundation for good data practices. These principles emphasize that data should be attributable, meaning we can trace it back to who created or modified it. It should be legible, so it's readable and clear. It needs to be contemporaneous, recorded at the time the activity occurs. Data should also be original, not altered or copied without proper documentation. Accuracy is vital. We need to ensure the data reflects the true situation. And finally, it must be complete and consistent, with no missing information or discrepancies over time. Moving on to specific data integrity findings, common issues include missing raw data, which hampers the ability to verify results. Unofficial worksheets or notebooks often appear, raising questions about data authenticity. Shared user IDs or passwords can compromise accountability, making it unclear who made certain entries. Disabled audit trails are a serious concern because they eliminate the record of changes, and unexplained data changes undermine trust in the data. Inadequate review of audit trails means potential issues go unnoticed. Lastly, deleting electronic records without proper justification is a red flag that can indicate data manipulation or loss. All of these observations highlight the importance of maintaining robust, transparent data practices, which are critical to regulatory compliance and overall data integrity. Let's talk about some of the common deficiencies we see in manufacturing documents and why they matter. When these issues occur, they can lead to significant consequences such as delays in batch releases, which can impact our overall production timeline. They also raise concerns about product quality, which is critical to maintaining customer trust and regulatory compliance. Additionally, these deficiencies often result in increased inspection observations, meaning more scrutiny and potential delays during audits. Now, looking at the typical problems found when reviewing batch manufacturing records or batch production records, we often see incomplete manufacturing entries. This could be missing steps or unclear documentation, which hampers traceability. Missing line clearance records are another common issue. They're essential to ensure no cross-contamination or mix-up occurs between batches. Incorrect reconciliation calculations can lead to improper accounting of materials and processes, affecting batch consistency. We also frequently encounter unverified critical process parameters, which are vital to ensuring the process stays within control limits. Missing deviations or investigations mean potential issues are not properly documented or addressed, risking quality and compliance. Lastly, QA review not being performed adequately can allow errors or inconsistencies to slip through, undermining the entire quality system. All these deficiencies highlight the importance of thorough, accurate documentation. They directly connect to our overall goal of ensuring product quality and regulatory compliance, and addressing them helps us reduce risks and improve our manufacturing reliability. Now, let's take a closer look at some of the common issues we see in laboratory documentation. One major concern is missing chromatograms or raw data, which can really undermine the integrity of the results we rely on. In addition, Incomplete calculation verification can lead to errors slipping through, so it's crucial that every calculation is thoroughly checked. Sometimes, we encounter unexplained repeat testing, and that raises questions about the consistency and reliability of the data. Incorrect integration practices can distort the analysis, highlighting the importance of proper technique. Another point to watch for is the lack of an audit trail review, which is essential for traceability and accountability in our processes. Uncontrolled spreadsheets pose risks because they can easily become outdated or contain errors that go unnoticed. And finally, inadequate investigations into out-of-specification, or OOS, results can leave critical issues unaddressed, potentially impacting product quality. From a regulatory perspective, the key focus is on ensuring that all laboratory data is scientifically valid and traceable. This means we need robust documentation practices to support the integrity of our data and maintain compliance. When we talk about overall quality and compliance, these documentation issues highlight the importance of maintaining rigorous standards to uphold trust in our laboratory results. Let's take a closer look at the electronic record and system findings. First, the regulatory expectation is clear. Systems need to be validated, secure, and capable of providing traceable electronic records. This is essential to ensure data integrity and compliance. When we consider the applicable regulations, we see references like 21 CFR Part 11 and EU GMP Annex 11, which set the standards for electronic records and signatures across different regions. Now, moving to the deficiencies we've identified, one of the major issues is inadequate system validation. If a system isn't properly validated, its reliability and compliance come into question. Weak access control management is another concern, meaning that unauthorized users could potentially access or modify records, which poses a significant risk. Sharing login credentials further exacerbates this issue, as it removes accountability and traceability. We also found a lack of periodic audit trail reviews. It's crucial to regularly review these logs to detect any anomalies or unauthorized activities. Missing electronic signature controls can undermine the authenticity and integrity of electronic records, which is a serious compliance gap. Lastly, inadequate backup and recovery procedures can jeopardize data availability and integrity in case of system failures or disasters. Overall, these findings highlight the importance of robust validation, access controls, and audit processes to meet regulatory expectations and ensure system integrity. Let's take a closer look at some of the investigation and CAPA deficiencies we've identified. First, we've noticed delayed deviation closures, which can really hinder our ability to address issues promptly. Next, weak root cause analysis is a concern because without understanding the true cause, our corrective actions may not be effective. Additionally, we've seen instances where CAPAs are not properly linked to the root cause, meaning the solutions may not be targeting the real problem. Ineffective CAPA implementation is another key issue. If the corrective actions aren't properly executed, the problem persists. We've also identified missing effectiveness verifications, which are crucial to ensure that our solutions are actually working. Finally, incomplete investigation reports can leave gaps in understanding what happened, making it harder to prevent recurrence. All of these deficiencies contribute to ongoing challenges, such as recurring deviations and overall ineffective management of our quality system. Addressing these issues is essential for strengthening our processes and ensuring continuous improvement across the board. Let's talk about some of the personnel and procedure-related issues we've identified. First, there's the concern that personnel are not always trained on the most recent SOP revisions. This can lead to inconsistencies in how procedures are followed. Additionally, we've found that training records are often incomplete, which makes it difficult to verify who has been trained and when. Another issue is the use of outdated procedures. Relying on obsolete SOPs can cause deviations from current standards and best practices. We've also seen instances where approved SOPs are not being followed properly, which undermines our quality and compliance efforts. Finally, there's the lack of reviewer competency assessment. Without proper evaluation of those reviewing procedures or training, there's a risk that errors or gaps could go unnoticed. Now, from a regulatory perspective, the expectation is clear. Personnel must be adequately trained and qualified for their specific responsibilities. This means ongoing training, proper documentation, and regular assessments are essential to ensure everyone is competent and up to date. When these elements are in place, it helps us maintain the integrity of our processes and stay compliant with regulatory standards. Let's take a closer look at some of the common contributing factors that lead to audit findings. These root causes can really undermine the effectiveness of our controls and processes. For example, inadequate review procedures often mean that issues aren't caught early or thoroughly enough. Without proper review, errors can slip through the cracks. Lack of quality assurance oversight is another big factor. If there's no oversight, it's easy for mistakes to persist and go unnoticed. Insufficient training also plays a role, because if team members don't have the right knowledge or skills, they're more likely to make errors or miss important details. Poor documentation culture can be a silent problem. It makes it harder to track what was done, why, and by whom, which hampers accountability and transparency. Weak data integrity controls are equally critical. They compromise the accuracy and reliability of our data, which impacts decision-making. Inadequate workload management can lead to rushed or incomplete work, increasing the risk of errors. And finally, a lack of risk assessment practices means we might not be identifying and addressing potential issues proactively. Now, all of these factors can have significant organizational impacts. When these weaknesses are systemic, they tend to create a cycle where similar audit observations keep recurring. That's why addressing these root causes is so important, not just to fix individual issues, but to strengthen our overall control environment and build a more resilient organization. Now, let's look at some of the preventive actions we're implementing to strengthen our compliance systems. First, we're making SOP improvements to ensure our procedures are clear and effective. Regular periodic internal audits are also crucial. They help us identify potential issues early before they become bigger problems. We're adopting risk-based review processes, which means we focus our resources on the areas with the highest potential impact. Additionally, electronic system enhancements are being rolled out to improve data accuracy and streamline workflows. We're also promoting data integrity awareness programs to ensure everyone understands the importance of maintaining accurate and reliable information. The overall objective here is to prevent recurrence of issues and reinforce our compliance framework. When we do find gaps, we're addressing them through corrective and preventive actions, or CAPA. This involves immediate correction of deficiencies, revising relevant documents and records, retraining personnel as needed, and strengthening our review controls. All of these steps are interconnected. By proactively improving our systems and responding decisively when issues arise, we aim to build a stronger, more compliant organization that consistently meets our standards. Let's now turn our attention to some recommended best practices that can really make a difference in maintaining and improving quality. First, continuous improvement is key. Regular management review of quality metrics helps us stay on top of performance and identify areas for enhancement. Monitoring the effectiveness of CAPA, or corrective and preventive actions, ensures that issues are truly resolved and don't recur. Ongoing compliance training keeps everyone up to date with the latest standards and regulations, fostering a culture of compliance. Moving to compliance enhancement measures, implementing robust GDP procedures is fundamental to ensure integrity in our processes. Conducting independent second-person reviews adds an extra layer of oversight, catching errors before they become issues. Periodic audit trail reviews are also crucial. They allow us to verify the integrity of our records and processes over time. Using validated electronic systems helps maintain data accuracy and security. Maintaining reviewer qualification programs ensures our team remains skilled and competent. Regular internal audits are essential. They help us proactively identify gaps. Trending recurring review errors and deviations allows us to focus on persistent issues and address root causes. And finally, promoting a strong quality culture and accountability encourages everyone to take ownership of quality in their daily work. All these practices, when combined, create a robust framework for continuous improvement and compliance. In conclusion, effective document review is absolutely essential for maintaining GMP compliance and ensuring data integrity. When reviews are thorough and accurate, they help prevent issues before they arise. On the other hand, common audit findings often stem from weak review practices and poor documentation control, which can undermine the entire quality system. That's why having strong quality assurance oversight and well-trained personnel is so crucial. They help minimize compliance risks and keep everything on track. Additionally, timely investigations and the implementation of corrective and preventive actions, or CAPAs, are vital for continuously improving our quality systems. They allow us to address issues quickly and effectively. Lastly, adopting proactive review processes not only keeps us prepared for inspections, but also enhances patient safety by catching potential problems early. All of these points tie back to our overall goal, maintaining the highest standards of quality and compliance through diligent review practices. That's how we build trust and ensure the safety and effectiveness of our products. For further support, please don't hesitate to reach out. We're here to help you with any questions or additional information you might need. Remember, your success is our priority, and we're committed to providing the assistance necessary to achieve your goals. Thank you so much for your time and attention today. We truly appreciate your engagement and look forward to supporting you in the future.